11.71%, nearly 1 in 9 infants in Merck's clesrovimab trial, suffered serious reactions, including seizures, brain injury, and even death. Does that sound like protection to you?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. Today we're examining what the FDA just approved for babies across the country.
When a product claims to shield your child yet raises the risk of the very illnesses it targets, you deserve the full picture. We'll lay out exactly what the clesrovimab data show so you can decide whether this shot belongs anywhere near your newborn.
RSV, or respiratory syncytial virus, is so common that almost every child catches it by age 2, yet only about 25 U.S. infants die from it each year. Despite that low mortality, regulators fast-tracked a one-size-fits-all dose, 105 milligrams, into every infant, whether your baby weighs 12 pounds or barely 5.
Uniform dosing sounds efficient, but in pharmacology, dose matters more than convenience. Tiny preterm babies will circulate a far higher concentration of drug than a chunky 6-month-old. Dr. Peter Selle, who combed through the data, warns that side effects rise sharply with exposure, so the smallest infants shoulder the greatest risk.
Let's look at the numbers. Out of 2,409 healthy babies injected with clesrovimab, 3 died, versus 1 death among the 1,202 placebo babies, a 50% higher risk of death. Serious adverse events of any kind hit 11.71% of the shot group, compared with 9.06% in placebo.
The neurological picture is even starker. 25 infants in the treatment arm experienced febrile convulsions, seizures, facial paralysis, or other brain injuries, versus just 4 in placebo. That's a 3-fold increase, and neurologic harm in early life can echo for decades.
Respiratory outcomes tell another tale. Infants receiving the drug faced a 3.5 times higher risk of upper respiratory infections and a 63% jump in lower respiratory infections, the very ailments clesrovimab is supposed to prevent. How is that acceptable efficacy?
Merck argues the shot slashed RSV hospitalizations by 84%, compared to placebo, mirroring Sanofi's rival product, Beyfortus. But Beyfortus uses weight-based dosing split into 2 injections, tempering exposure. With clesrovimab, that entire dose arrives in 1 needle, concentrating risk at the front end.
Keep in mind, these are monoclonal antibodies, lab-made proteins that give passive immunity. They're not vaccines. They don't train your immune system to remember RSV. Once the antibody level fades, so does protection, leaving only the side effect history behind.
Because they're classified as drugs, safety reports don't flow into the CDC's vaccine reporting system most doctors watch. Instead, they must be filed through FDA MedWatch, a pathway many clinicians and virtually all parents never hear about. Underreporting becomes almost guaranteed.
MedWatch also lacks the real-time public dashboard VA-EARS provides, so patterns can hide for years. By the time signals emerge, say, a spike in seizures, tens of thousands of infants could already be exposed, and early warnings would be buried in separate, hard-to-access PDFs.
Another blind spot is time. Trials ran during seasons of low RSV circulation, meaning relatively few severe cases occurred in either group. When an outcome is rare, even a handful of misclassified events can skew perceived benefit, yet the FDA still labeled efficacy robust.
Financial incentives amplify the push. Beyfortus hauled in $1.8 billion in 2024, and Merck naturally wants a slice of that pie. But a market opportunity isn't a medical necessity, especially when disease risk is already low.
Another concern is antibody-dependent enhancement, or ADE. When antibody levels drop below neutralizing strength, they can actually help the virus enter cells more efficiently. Clesrovimab is engineered to linger 80 to 120 days, long enough for levels to drift into the risky middle ground.
Lab studies show RSV antibodies can prime lung macrophages for greater infection when concentrations are subneutralizing. Yet the trials weren't designed to track second or third RSV encounters after antibody decline, so regulators are flying blind on that front.
Clinicians would have to watch for unexplained wheezing months after injection. But if they don't link it to prior clesrovimab exposure, the adverse event vanishes into ordinary insurance codes. That's why transparency and post-marketing surveillance matters.
Given these uncertainties, prevention strategies that build true resilience deserve attention. During peak season, October through April, avoid crowded indoor spaces and delay daycare if possible. Each week of maturity strengthens your baby's natural defenses.
Breastfeeding is another powerhouse. Your milk delivers RSV-specific antibodies plus immune modulators such as lactoferrin that adapt daily to threats in your environment, all without needle-related risks. Benefits extend well into adulthood, influencing metabolism and immunity.
Expectant mothers, your health sets the baseline. Prioritize nutrient-dense foods, adequate folate, balanced omega-3 fats, and microbial diversity before birth. Lower stress hormones because cortisol crosses the placenta and shapes infant immunity. Choosing organic produce when feasible and filtering drinking water further reduces exposure to pesticide residues and endocrine-disrupting chemicals that could compromise early immune programming.
Daily gentle sun exposure adds a free layer of defense. Ultraviolet B triggers vitamin D synthesis, which tunes respiratory immunity. A morning walk with uncovered forearms, no sunscreen, no sunglasses, supports both your circadian rhythm and your baby's once they join you outdoors.
Indoors, aim for 40 to 60% humidity. Dry air lets viruses travel deeper into tiny airways. Use a clean humidifier and skip harsh chemical cleaners. Simple vinegar or diluted hydrogen peroxide sanitizes without adding respiratory irritants.
Consider saline nasal drops before bedtime to keep airways moist, and wipe frequently touched surfaces like doorknobs, crib rails, and phone screens. You don't need hospital-grade disinfectants. Consistency and balanced humidity cut viral load dramatically.
Layering simple routines magnifies protection. Regularly wipe surfaces with vinegar or hydrogen peroxide instead of bleach, and maintain steady humidity. When you combine these basics with breastfeeding and gentle sun, you create a multi-pronged defense drawn entirely from the article's guidance.
At the same time, minimize unnecessary pharmaceutical exposures and environmental toxins during those critical first months. The fewer metabolic stressors your baby processes, the more bandwidth their immune system retains for genuine threats.
You might wonder, what if my pediatrician insists on the shot? Bring the raw numbers. Ask why a threefold rise in neurological events is acceptable, and how safety will be monitored when reports disappear into MedWatch. Informed consent means real discussion, not blanket reassurance.
Also ask whether your practice will individualize dosing for premature babies. If the answer is no, because the product's label forbids it, you have evidence-based grounds to decline until weight-appropriate options exist.
Ultimately, the decision rests with you, the parent. Regulators may greenlight drugs, but they don't live with the outcome. Weigh the 11.71% serious event rate against a virus that is rarely fatal and often mild.
Here's your practical challenge. This week, carve out 30 minutes to read the clesrovimab clinical trial report yourself. Highlight the death counts, the neurological adverse events, and the infection rates, then discuss them with your child's doctor before RSV season begins.
Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.